2, 3. Yate, my name is Judy Jackson. Tulichin Shlom, but Antibashichin, Nakatane Yat Dashache, Skanso Yat Dashanala. That's how I identify as a Navajo woman. My final project will be on the impact of HIV and AIDS on the Navajo Nation. The Navajo Nation consists of 3 states that include Arizona, Utah, and New Mexico. It covers over 17 million acres, and the 2010 census has Navajo Nation at 300,000 tribal members. As HIV and AIDS is not talked about or rarely mentioned on the Navajo Nation, and it is also considered a taboo to talk about death or to bring death upon oneself. As the number of HIV and AIDS infections continue to increase on the Navajo Nation, there have been different measures and steps that have been taken by numerous organizations and health education that exist either on the reservation or in border towns. The first case of HIV and AIDS was in 1987, and the individual lived just a few days. In 2012, there have been 47 new cases, and 87% is men who have sex with men. And in 2011, there have been 39 new cases. And in 2010, there have been 35 new cases, and in 1999, there have been 10 new cases. Alcohol abuse is the #1 main factor of individuals that put individuals at risk for HIV and AIDS. And HIV and AIDS testing is available to anyone on the Navajo Nation from the age of 13 years of age on up. And in the Navajo language, there is no such word for AIDS or HIV. So when tribal health educators have to go out into the community and do HIV/AIDS education, they would have to do their presentations in Navajo and in English for individuals to comprehend their presentations. Individuals who speak solely Navajo may have a hard time understanding a presentation if it's solely in English, as English is their second language. Some measures and steps have been taken to address the impact of HIV and AIDS on Navajo Nation, such as organizations such as the Navajo AIDS Network and the Navajo Nation Health Education Program that has a program as the HIV and AIDS program. As the Navajo Nation continues to address one individual from the Gallup Indian Medical Center, Dr. Jonathan Erlu, has taken initiatives to help address the increasing number of HIV and AIDS on Navajo Nation. Dr. Erlu oversees the HIV programming at the Gallup Indian Medical Center, as well as he has several staff members that assist him when clients are newly diagnosed, or clients that have been diagnosed with HIV and AIDS, and gives them proper care and treatment, as well as referrals. And one most important thing at the services provided by Gallup Indian Medical Center is that they have a traditional specialist that would work with patients that are infected or newly infected with HIV and AIDS, for patients requesting traditional ceremonials instead of seeking Western medicine. As Native communities across the country continue to come together in the fight against HIV and AIDS, the National Native HIV/AIDS Awareness Day has been created and is set for March 20th of each year, as it is also the first day of spring. So throughout Indian country, including the Navajo Nation, numerous events take place, such as health fairs, walks, and fashion shows to bring awareness to help educate individuals to know their HIV status.